Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, well,
good morning.
Good morning, Dr. Mencia. I always love seeing you here. You know, you're one of the very few people, professional and hardworking, and you always come to this radio show. I admire you so much about this. I can't tell you.
Thank you.
You are. You're a dream person. All the things, at least for me, the quality of someone who the commitment is there, and I know that's the way with your patients. I have seen it every time I go there. And this last thing, we never got to talk about this. Mother Ratasha, I think I did talk about it last week after you had gone.
After I left, yeah.
Yes, after you left. But Mother Ratasha came with her head disciple, and he had a serious problem with his hand. And Dr. Mencia dropped everything he had to take care of him properly. And you have the loyalty of Mother Ratasha. She says, "You're my doctor now when I come here." And I mean, you did a beautiful job for them. Thank you.
That's an honor. That's an honor to, care for.
Well, and also you don't know much about her disciple, but he is a very
loyal.
Very loyal, but he's also very, he watches people a lot. And, and he can tell very quickly if he's going to let you do anything with him. And he did. You caught him. I mean, he knows who you are. It was wonderful to watch that. And you knew how to deal with him. Well, you do that with all your patients. You know how to deal with people. Yes. That's your psychology
exactly.
background.
It's just the fact that before I became an MD, I had my psychology training. So, the behavior is very important in how to approach a person and, when to demand something and when to wait for the right time.
Yeah, and you were fabulous because the story was that they were going on a cruise to reach out with the religion of love all over the Baltic, and he was going to go on a cruise ship. And when Dr. Mencia saw what he had, he said, "Oh no, I got to help you do stuff." And so I haven't heard from them, and I didn't figure I would, but that could have been treacherous. And maybe it's a good point, Dr. Mencia. Now, if you're going to go on vacation, you better make sure that you're in good health before you leave this area.
Absolutely. If you have, like in this case, this gentleman had an infection on the hand, and infection of the hand can be very, very tricky. You can have an infection, let's say, by the knuckle area, but the hand is filled up with tunnels. So you have an infection by your knuckle, but it's traveling under the skin, and it's tunneling through the skin, and sometimes you look at the forearm or the elbow, and you see redness there. You think they are two different things. It's the same infection that you just spread into those tunnels. So also, if you're having any shortness of breath or you're having any chest pain before you go, a little palpitation, don't write it off and say, "Oh, it's gonna go away." Go and get checked. We had a patient that just had a open heart surgery, and they were going to travel to Niagara Falls. And the husband brought her to me, and I said, "No, I don't think she can travel." So we bought the ticket. I said, I'm going to write a letter saying that you cannot travel. Then the next day, he said, she's having some shortness of breath after the surgery. She went into a rhythm called atrial fibrillation in the heart. So she is back in the hospital getting the heart rhythm corrected. If she would have been traveling, this could have been a catastrophe. So whenever you're going to travel, yes, you should get yourself checked. There is nothing wrong with a, quick checkup with the doctor, check your blood pressure. If you're going to go for a short trip, make sure you have enough medication with you. If you're going to go 2 or 3 months out of the country, make sure you take, most insurance will allow you to pick up 3 months supply with a note from the doctor saying that you're going to be out of the country, and they will give you enough medication.
And you came in and you wanted to say some things about the hurricane season, and maybe that's a good point about the medication that, if we're going to have a lot of rain like we've been having and all.
Well, yeah, look at last week. No hurricane, nothing like that, but torrential rain coming down. And was difficult for people to get out. I was amazed. Most of my patients, if not all of them,
they
came to the office. There was no question about it.
Right.
But it could be difficult traveling with all the water and all of that. And if it's a hurricane, it's going to be a lot more difficult. So please make sure now during the hurricane season that you're always checking your medication. Don't wait until you're running short. You can always have a prescription at the pharmacy waiting for you if you call the doctor and let them know that you are about 1 week from running away from your medication. And keep an eye on the forecast. They are very accurate nowadays and gives you a good idea of what to expect. So if you see that the weather is going to be really bad and you see that you are in need of some of your medication, then go and pick them up before time. And also your first aid kit. You have to make sure that you have bandages, alcohol, iodine. Have something at home for your first aid available. If you recently relocated to a new home, you want to look at your new home to see what will be where in the new home will be the safest place for you to stay during a hurricane.
You just used the word iodine. I haven't heard iodine in so long. What do we use iodine for now?
Iodine we use it when we're going to do surgery to kill any bacteria on the surface of the skin. So if with any cut or anything like that you want to keep it clean, then iodine is
better than peroxide.
Peroxide has its job once the skin is already open or something like that, but the iodine is even on a healthy skin. So you notice when people are going to do surgery, they paint you with the iodine.
They do, yes.
Yeah. So that's to keep the sterilization of
because now it's Neosporin. Just like, when you said to him, though, the gentleman that you took care of, you said,
Bactroban
said
Bactroban.
Neosporin is what you said that you could put on there and all that
on the wound, right?
Right, on the wound. But you didn't say iodine.
No, because he's taking already
it hurts.
antibiotic.
Iodine does hurt if on an open wound.
Yes, it can hurt. No, but he's on oral antibiotic.
Yeah, that's right.
And we gave him an injection of antibiotic.
I saw that. See, as compared to just giving him pills.
Just giving him pills. Because
he needed it fast, didn't he?
Exactly. Because like we said, the hands are very tricky, and you have to be aggressive to prevent. I have one of my patients, she's a chiropractor, and she got bitten by a dog, and she just had a little opening where the...
little puncture wound with the teeth.
And the next day, it was already spreading to the forearm.
Whoa.
Right by the elbow. It was
something to do with the dog's saliva, isn't there, or something? Mm-hmm. I want to give everyone... I don't want to wait to the end. Dr. Mencia is such a rare treasure.
We get so much into our...
I know. It's such a rare treasure. I want everyone to know. Call for an appointment. It's interesting. If you... Mother Ratasha's traveled all over the world, and when she met Dr. Mencia, and when we got back into the car, she said to me, he's very special. She said, when I come here, I'm definitely going to see him. And that's how we all feel. Once you meet Dr. Mencia, you know that he is rare, and we're so appreciative of having him here. This is his number. It's 954-489-1345. All you have to do is call that number. There's always a live person there, at least during the working week. And if not, you really need him in an emergency, they'll be able to get him. But it's 954-489-1345. And his website is adultgeriatrics.com. Adultgeriatrics.com. And the reason it's called that is because he is a geriatric physician. There's a difference in an excellent physician and one who is a geriatric physician. If you're over 60, you really ought to consider someone like that. I want to rush to something else because being a psychologist at heart, when you're talking about the rain and you're talking about staying inside, what does that do to an older person who lives alone?
You can become very depressed. Even though we see more depression in the wintertime, for us in Florida, is during this time in the summer, because it becomes very difficult to go out and enjoy Florida. So a person can become depressed, and the recommendations are, from the psychological point of view, is to open your window, let the
blinds, so
open
let
your
the light
blinds,
in.
let the light come in. A lot of people, especially the elderly patients, they are afraid to open the blind. They don't want people looking in and what have you. But wherever you're sitting, if you're gonna sit in the living room, open your blinds. Let the air come in. And the good thing about that is you can see better where you're walking, and less chance of falling.
And get yourself some fresh flowers.
And when you go to the supermarket, bring some flower with you. I do it all the time. I bring it to my apartment, bring my flower, put them on.
I feel the same way. And I mean, it seems silly, but I know it
my
makes
candles.
Okay, that's the other thing, right? It's you have to really, and I think that older people, there are a lot of people in like a little development, and they're all in their own little apartment, their own little cave. They should get together. They should try to help one another.
Right.
But so I know when someone comes in, can you tell when someone comes
if
they're depressed?
Oh, absolutely. Oh.
How can you tell?
They will not make eye contact like you and I are doing now. They won't do that. When you're talking to them, they won't smile. They might bow their head, but they won't smile at you. And then when you ask them, are you sleeping well? They probably will say, no, I don't sleep well. How's your appetite? Oh, I lost my appetite a little bit. And what is the thing that you love to do the most? Playing cards. Do you feel like playing cards? Not really. So they loss of interest, loss of appetite, loss of sleep.
So what do you do to help them?
And when I'm teaching the students, I usually tell them that a depressed person sort of make you feel depressed. Yeah, because
a depressed person will make you feel depressed?
Will make the provider feel kind of depressed. And that's how I say, well, a person that is happy will make you feel happy. So what we do to help is try to get to the root of the problem. That should be the title of my book.
The root of the problem.
So, with one of my patients, she lost her husband. And she's take me like her son. Any personal problem that I have, 3 years back, she still come and ask me, how is this going with this? How is that going? I say, it's okay, Lillian. Everything is okay.
Yeah.
So, but she lost her husband of many years. And, of course, she has what we call in psychology reactive depression, which is a normal depression. You lose somebody over 60 years of marriage, you will feel empty. Mm-hmm. And the family come by and support her, but that's not enough. Because at the end of the day, everybody go home and she's alone in the house. So in those instances, better than a pill or anything like that, best thing to do is to have people come over and visit frequently, and people to stay for a little while. And the family, not only the nuclear family, but the family, the extended family, make some rearrangement so that this person is not left alone, at the time of need, like now.
When you were talking about that, as soon as I heard this, you know how many people, after they've lost a spouse or they're depressed, the physician puts them on an antidepressant.
Antidepressant immediately.
And I want your opinion on that, because look, maybe you feel it's okay for a week. I don't know. I don't think people should be on them, but it's up to whatever you think.
No, well, antidepressant, they can have a significant side effect to them. And if it's a reactive depression, That means that the chemicals that will fight the depression, they are all there. You just need to activate them. So you don't need the drug. When I give a antidepressant to a patient, it's because either they have chronic depression or they have a depression that is lasting for a long time and they cannot get rid of it. And I say, okay, we're gonna need an antidepressant to help you get you out of this depression, because at that level now the chemical in the brain, they are off. So you need some norepinephrine or serotonin, and we start adjusting medication depending on what is the presentation of that depression. Is it a depressed patient that is crying a lot, or is it a depressed person that is anxious and agitated? In geriatric medicine, a lot of people get confused with anxiety because they think, in younger patients, we see anxiety on one extreme and depression on the other one. But in the geriatric patient, a depressed geriatric patient can become very anxious. So if you start treating the anxiety, you're going to make the depression worse.
Really?
Yeah. So it's better to treat the depression so we can correct the anxiety. And there are medications that will help us do that. There are medications that they are a pure lifter that won't help with anxiety. There are other medications that will lift you up, but also will help you with the anxiety component of the condition.
But you have to know the difference, Dr. Mencia, and see, that's so many people are just the doctors. I mean, I don't, it's nothing against doctors. I'm just saying that it seems like the person's depressed. They want something to help me, give me something.
Yeah, it's nothing against doctors. It's one of the objectives, what helped me get up in the morning to come to the show every Saturday is that I'm a firm believer that a smart consumer is what we have to become. When my staff told me about we need to do let's get some omega-3 to sell here at the office. And I have no problem selling the omega-3 because of the convenience. I wish I could have a pharmacy at the office. So
that's people, coming. I can just feel it. I know, because
so people can walk away with their drugs and go, with the antihypertensive or medication for their heart or the lung. I wish I had that for the convenience of the patient. So when the staff told me, you recommend so much omega-3, Dr. Mencia, and the patient keep coming back, which one should I buy? Which one? So we did our research and look at all the omega-3 to see what was good, what was bad. And talking about omega-3, there was a article that just came out that tried to do correlation between fish oil and prostate cancer. And it was not published. The first thing the audience need to remember, it was not published in an official journal in any part of the world. It was on the internet. It's an internet journal that the article got published. And they review people taking selenium and other medication. And the finding of omega-3 was not the primary endpoint, meaning that the study was not catered, was not tailored for the to look at omega-3 and positive or negative effect. They just noted that the patient that did develop prostate cancer, that they were taking omega-3. But that could be a skewed conclusion, because a lot of men out there and women are taking now omega-3. So it's like saying that aspirin produces prostate cancer, because a lot of the geriatric patients are taking an aspirin. So if they develop prostate cancer, doesn't mean that the aspirin produces that. So we have to be careful with what comes out in the internet, because the fish oil, first of all, is classified into three major groups: the omega-3 and the omega-9. Those are the good fish oil, and then the omega-6. That's the junk fish oil. So when you buy your fish oil, remember that the FDA just required that they declare 2 of them, and you have to determine, you the consumer have to determine what the third one is. So if I sell to you omega-3 fish oil 1,000 milligram, it's not that you're getting 1,000 milligram of omega-3. You have to look at the back and see how much omega-3 you have there, let's say 100, how much omega-9 you have there, let's say 50. They won't tell you omega-6. Very few of the product out there, I've seen 1 or 2 that are brave enough to tell you that you are getting omega-6.
Oh, wait, stop a minute. You're saying that if I'm taking omega-3, I'm taking a fish oil, and I do, that they will not tell me if there's a 6 in there?
They won't tell you the amount. You're supposed to, by deduction, you say, okay, if I have 100 of 3 and 50 of 9, that's 150. Take that away from 1,000, that means that 850 could be your omega-6, another junk fish.
Oh, my.
Fish oil.
Wait.
So if you have 1,000 milligram and they say, 500 milligram is omega-3 and 350 milligram is omega-9, then that would be a very good fish oil.
Well, that's something new that I know you've talked about this. It didn't get in my head before. It's interesting, and I don't like to push particularly. Wow.
So when they did the study, they didn't break down. They have to, you have to look. Omega-6, you know where you get omega-6 from? French fry.
No kidding.
Hamburger.
I can't believe
Ice
this.
cream. So it's junk. It's a junk omega. So what you want, and I had a patient that I say, oh, you can buy this whatever omega-3 we have there. And he bought it the first time. Then he came back, with a big smile and a big jar of fish oil that he bought from one of the outlet store. And I look at the back, and it was loaded with omega-6. And I say, look, if you were my father, I would take this and throw it in the garbage and go and buy you something better. You don't have to buy the one in this office. Buy it outside. But this is junk. This is going to clog your arteries and give you a heart attack. And
I can't wait to go home and check. I don't usually like to name a thing, but I've been taking Carlson's omega-3, and it says, I didn't think it says there's anything else in this. Pure. It's, from Norway, and it's pure. And I thought it is pure omega-3.
Well, but you have to look at the back and break it down.
Okay, I'm gonna. That's a,
because
I'm gonna go right home and see about this.
If the omega-3 that I'm adding in your product is not synthetic, it's pure. I'm extracting it from the salmon.
That's what it says.
Then I can claim that it's pure. I'm not claiming that it's 100%. The whole product is pure omega-3. All I'm saying that the omega-3 you're getting is pure.
See, that's very it's the
it's
amount
very tricky. That's why I say,
okay.
we have to become smart consumer when we go to the doctor, when we go and buy product. We have to become smart consumers. A lot of doctors are now recommending the CoQ10 if you have any heart condition, the fish oil. I see more and more people now doing the vitamins level on their patients. So, I feel like we are making some way there.
Because you, for so long, you've been the one that someone goes to find out what's going on, because most doctors didn't know. But now you think that they're trying to figure out what's good.
Absolutely.
And, and people always say, well, if I'm eating the proper food, why do I need to take all that? But I guess you've said the food isn't the same as it was, and so you have to boost it up.
Exactly. And if you are a dietitian and you eat the right amount of the different kind of food available, you might not need to take any supplement. But that's not reality. The reality, like in my life, in your life, we are so busy. We are running left and right. And we need to keep the immune system at tip-top shape so that it can protect us. When the immune system is protecting you, not only you are preventing infection from taking over your life, you are preventing cancer from taking over your life. So the immune system becomes very important in fighting
immune system. And I don't know, did we ever do an article? I don't remember if we ever did an article on immune system.
We should do one.
An article, but also maybe a whole show on the immune system, because it seems like everywhere I hear, everything affects the immune system. And without the immune system in top condition, you're prone to get everything, just like you said. Well, I guess we've run out of time again, but let me give everyone your phone number. It's Saturday, too. You're open on Saturdays. So,
and home visits.
And home visits if you're real homebound. We want to make sure you're homebound. But it's very important for those of you who need to have a doctor who will go home. It's rare to find that. They really have now taken on some things that they know were necessary. Home visits for homebound patients, and also open on Saturday appointments. Phone number is 954-489-1345. And of course, this is the Dr. Mencia's A Wonderful World of Wellness, which says it all. Wonderful world of wellness. When you're well, life does, lots more sunshine comes into your life when you're well, isn't it?
Absolutely.
Thank you, Dr. Mencia. It's always wonderful to have
Thank
you.
you. I love you.
I love you too. And go make people feel good today.
Absolutely.
Okay, we're going to have a fast break before we talk to Joe Karp. Okay, thank you. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.